Next talk is by Dr. Raveendra. Reviving the Bleb, the right time to do the needling.
Thank you. Actually, this is a procedure that very few of us may be doing. How many of us have really done needling? Very good. Now I think after this talk, more of us will be doing the needling, because we often have blebs that are failing. And whether we should be really going for a new procedure or whether we should be trying to revive the procedure is the question that is top on our mind. And believe me, this needling is something that I started doing around 2014. And from then onwards, the need for repeat trabeculectomy has really come down. So, the timing, the procedure selection, and the risk benefit, all these things are most important. So, preoperative considerations, diagnosis of failing bleb. Then the next step is early intervention, then whether to do surgical needling, whether special situations like ologen are available, are being faced by us, and with surgical needling, whether it is ab interno or ab externo is also important, and use of surgical gonio lenses is also important. I don't think I'll be dealing with all the questions related to this. First, the basics on outcome. So we expect the trabeculectomy to work. If it works or not, we will tell the patient. We will be coming to know by the end of 3 months. Like cataract surgery, we say 1 week or 10 days or 15 days. But for trabeculectomy, we will say 3 months, and there may be need for multiple injections also. And then only we will be able to tell that, yes, this procedure has worked or not. So we are also going to be discussing that guarded filtration procedure is good from point of view of safety, but that for success to improve, we may be using mitomycin, 5-fluorouracil, and steroids for the longer duration, and needling. So this is also another depiction of the same thing. Before going for a repeat trabeculectomy or a revision of the trabeculectomy, we have this needling and antimitotics. So if the trabeculectomy is successful, IOP is below target, then yearly reviews, and then if target is maintained, okay. If target is not maintained, rise in IOP is there, then we may have to go for the needling. So either in long duration or in the immediate within 3 to 4 months also, we may have to do the needling. So before that, digital massage will be there, releasable sutures will be there, injection of 5-fluorouracil or mitomycin C will be there. So digital massage is something that we will be employing as a procedure within 10-15 days. But once the scarring has become more, this will be somewhat ineffective. So when it comes to needling, we have to look at features like extent of bleb, height of bleb, vascularity, and then based on those factors, we have to decide about whether we can go for 5-fluorouracil injection or mitomycin. So in case of high vascularity, we can use 5-fluorouracil injections, 2 per week for some days, some injections, or mitomycin injection subconjunctivally. Overview of literature, yes, prospective studies are there, but and retrospective studies are there, but randomized controlled trials are not there for this particular topic. So what happens with needling revision of blebs? ophthalmology 2008. And what happens with late needling of flat filtering blebs with adjunctive mitomycin C, 2011 article. Overview of the results. The factors that are important to consider are the duration. If it is long duration, means the trap was done sometime in the long distant past, the inverse effect is there. So chances of success will be less. But definitely, yes, success chances are there and it has to be considered. Bleb vascularity, more the vascularity, more the chances of success, because more the need actually. Okay, height is more than directly proportional, and more the number of needlings means some factor is there that is not being dealt with, and so chances of success are less. Now with the selected success rates, we are seeing 91%, 84%, 64%, 45%, and some articles are referring to it as 13%. So there is a wide range, but it only means that each individual surgeon has to customize the technique, and then they can see very good results in some cases, and some cases they may be able to. Then the complications are similar to trabeculectomy. What happens is that mild hyphema is there, or shallow anterior chamber may be there, or serous choroidal detachment may be there, mild vitreous hemorrhage, punctate keratopathy, transitional edema, all these factors could be there. And then the alternate methods may have to be used. Now, a flow chart on needling. So, we have to decide whether the duration is right. We have to look at the bleb features. We have to look at the gonioscopy. The gonioscopy is important because if we have to do needling, we have to be sure that the ostium is open. If the ostium is not open, it is better to go for a repeat trabeculectomy at a different site. So this cycle can go on. Trabeculectomy is done, digital massage is given, suture management is done, 5FU, needling, and then again, if it is failing, we can do the same. And
Sir, time.
that's time up for me, and I think topic is also done for me. Thank you.